Ron, he's quoting Bobby Kennedy, my hero. I mean, it's as good as it gets. Thank you, Supervisor. Thank you for the generous words. And Mr. Mayor, thank you for all your leadership. Thank you for inviting me here today. Mr. Superintendent, thank you. And to all the elected and appointed officials that are here and all the remarkable students. I feel, honestly, I really do feel at home. I'm very grateful for all of you and the gracious welcome, but I'm also incredibly grateful to the leadership of each and every one of you. You are defying the odds. You're stepping up and stepping in this pandemic. You're following science. You're keeping people healthy. You're keeping people safe. You're keeping people in school because you're following the science. And I'm here not only to recognize that leadership, to thank you for your resiliency. Thank you for your resolve, because I'm mindful of how hard this has been, how hard the last 18 months have been on each and every one of you, particularly parents and caregivers, particularly women that have been overwhelmingly burdened with having so much of the responsibility at home and the requirements to work so often as the case as well. And I just want to acknowledge that I recognize that stress. I recognize at times your frustration. I recognize the fear that many of us have as we now enter into the winter, as we enter into a season where, if past is prologue, we should anticipate an increase of cases, an increase in hospitalizations, an increase in people in ICUs, and tragically, the likelihood, if we don't take seriously this moment, an increase in the number of people that will lose their lives. It's an interesting fact that the state of California outperformed most other states this summer. We consistently had the lowest case rates, among the lowest positivity rates, and on a per capita basis of large states in the country, among the lowest death rates per capita of those large states. That's a fact. It's also a fact that the summer we just experienced was actually more challenging than the prior summer. More people were hospitalized this summer than last summer. More people were in ICUs this summer than last summer. And we experienced more stress across our system. That's in addition to the fact that we've led the nation in vaccination efforts. We've administered 57 million doses, more than any other state in the country. We've consistently been in the top 10 per capita of the number of doses that we've administered to adults. In fact, today we can lay claim to breaking 90% of all adults in the state of California have received at least one dose of the vaccine, 90.5%. But despite those high vaccination rates, despite the low case rates and positivity rates that we have enjoyed over the course of the last summer, we are anticipating, nonetheless, more stress as we enter into the fall for a number of reasons. Waning immunity, people that received their full dose of vaccines, the 1 dose of J&J, the 2 doses of Moderna or Pfizer, we have waning immunity after 6 months, and we still have a large percentage of our population that has not yet gotten vaccinated. And you know this well, Kings County, among the lowest vaccination rates per capita of any other county in the state, not this community, but the county. As a consequence, not surprisingly, you're among the highest per capita hospitalization rates. They're connected. We were just talking to your interim health director, 89%, 90% of folks that are in the hospital down the road, 90% are unvaccinated. This is not complex. This virus, this disease is not taking the winter off. It's coming back in force, and you're seeing that all across this country. You're seeing it in the Dakotas, you're seeing it in Colorado, you're seeing it in New Hampshire, Vermont, you're seeing it around the world, in Germany, Austria, what happened in the UK, what's occurring globally is an ominous reminder of the nature of this global pandemic, that it has seasons and it has there's an understanding of the ebbs and flows on the basis of the experience we've all had over the last 2 years. So we should anticipate that we are going to see an increase in cases. We have an increase in potential stress on our system. I don't say that to alarm people. I don't say that for any other reason than to level set with folks. And that's why I'm here long-windedly, to remind people to avail themselves. Anyone who wants a booster can get a booster shot. If you have been vaccinated and it's been 6 months, now you can get a booster shot 18 and over. California was the first state to say, get a booster shot. They're in abundance. About 60% of people are getting their booster shots in pharmacies. Others are getting their clinics. Others are getting it right outside here, this high school. And I just want to thank all of you here for the partnerships that you formed, creating these safe places, creating these community places where people know people, feel comfortable, can ask questions, address anxieties and concerns, and a lot of the misinformation that continues to be out there. This is what it's all about. So we're here promoting boosters, and we're here also promoting the vaccine, this life-saving vaccine. It's not too late to get that first dose. And remind people you can get it free, regardless of your immigration status. We've never had more sites and more abundance in terms of these vaccines. We want to keep people safely in schools. We don't want to close these schools down. We want to keep our businesses open. We want this economy to fully recover and thrive. And the quickest and fastest way of doing that and ending this pandemic, getting this behind us, is getting vaccinated. So that's the purpose of this trip. Again, recognition, appreciation, respect for a job well done, and also a reminder that these boosters are important to deal with waning immunity and important to help us get through this winter so we do not experience the winter we experienced last year. So with that, of course, we're here to answer any questions, but again, gratitude and respect and appreciation for the remarkable job, Mr. Mayor, you've done in this community, Supervisor, you've done in this county against a lot of opposition and a lot of prevailing wind moving in different directions.
Are you concerned that low vaccination rate here in the Central Valley? And what would you also tell Latino parents who now have the opportunity to vaccinate by 11 years old?
Well, my 12-year-old got vaccinated a few weeks ago. My 9-year-old's getting vaccinated this afternoon. I want to encourage people and remind people, those parents, that in order to attend a school like this, you've had to get 10 vaccinations. Vaccinations have been around over a century. They're safe. And I just find it fascinating that you have folks out there waxing on about the dangers of vaccines, and yet they're vaccinated. Their kids are vaccinated. They haven't been complaining about the measles, mumps, polio, and whooping cough vaccines their kids have been getting, those that they've sponsored themselves and promoted. The politics of this has just gotten out of control, out of hand. These vaccines will keep your kids safe and healthy, will keep your family units safer and more healthy, will help us get through the holidays without experiencing a loved one getting sick, God forbid ending up in the hospital or in the ICU, and will keep our kids in schools. And I should just note, because of our high vaccination rates in California, we're outperforming the rest of the nation, not only in per capita deaths, in case rates, positivity rates disproportionately, but also keeping our schools open without having to close them. You compare the number of schools that have closed in California versus Florida and Texas, places that don't believe in masking, don't believe in vaccination rates, their schools are opening and closing, opening and closing. Our schools have stayed open because we've attached ourselves to common sense and science in an understanding of our history, our proud history of allowing people to live their lives and thrive because of the success of our vaccination efforts that have kept measles and polio and whooping cough at bay for a generation. And so I'd say to those parents, I'd say to those kids the same thing as a parent myself, get vaccinated. Parents, get the booster shots.
Governor, when speaking about cases and hospitalizations, the Valley disproportionately hit hard, especially in the last few months. You look at the Delta surge, and some of these hospitals with the most COVID patients really out of any hospital in the state. You look at Korea Health, you look at CRMC, there's been huge staffing problems. I know that the state has supplied some extra staffing through the end of November, go into this holiday season with most counties' vaccination rates at 60% or lower, is there plans to extend that even further?
Yeah, I extended the executive order last week that allows more allows more waivers and more staffing flexibility. So that was formally extended. We have also pre-positioned, on the basis of our experience last year, a series of interventions, including contractual opportunities to get contract staff from outside of the state to allow for surge staffing. We have technical assistance teams that we've organized to help communities, particularly here in the Central Valley with lower vaccination rates and higher hospitalization rates. I'm very mindful of Riverside and San Bernardino and the increase in COVID cases. We're seeing that in counties that have lower vaccination rates. In counties that have lower vaccination rates, we're also seeing higher death rates per capita. These things go hand in hand. People can express denial, but they can't experience that in terms of the lived experience in those communities and in those hospital settings, as you have wisely and appropriately described. And that's why I'm here to remind people there's a way of getting out of this. Get the booster. Get vaccinated. Vaccine is the passport to ending this pandemic. We can get through this and be done with it. But you can't deny reality. And a lot of folks are just in denial because they're exhausted. They can't take it. I get it. They're just exhausted. But we have to maintain our discipline. We have remarkable resiliency. The state is outperforming economically with a tenfold American job recovery. Our kids are safely back into school. We have nation-leading vaccination efforts. We're doing the right things, and we're performing. We just need people to hold on a few more months. Let's work our way through this winter surge. My belief is if we can do that and get those vaccination rates up another 5–10%, that we'll be in a completely different place come next spring and summer, the place where all of us look forward and want to be.
Governor, there is some towns in this county that they only have the 27% of vaccinated.
Yeah.
So why do you think this is happening?
Well, there's a lot of people that are knowingly and intentionally misleading people, lying to people, quite literally lying to people. I got a booster last week, and folks said I had a reaction. They just made it up. It spread like wildfire. It's completely made up. People making things up. It's sad, you know. As I said, I'm a parent. My kids ordered to go to schools, and public schools. By the way, Florida has some of the most restrictive vaccine mandates in America. Yet their governor doesn't like this vaccine for some reason. It seems to me a little political. You could pick and choose. And so we've got to disabuse ourselves of that misinformation. And we need to hold some of our leaders accountable to the fact that they've gotten life-saving vaccines, and yet they're out there promoting conspiracy theories and lies. At the same time, discouraging their constituents from getting the same life-saving vaccine that they themselves have gotten. And you've seen that, particularly in the Central Valley, in a lot of instances, with respect. And the reason I keep coming back over and over and over and over again to the Central Valley is I'm trying to counter that. And I'm here promoting boosters, not in San Francisco, not in LA. I'm here in Kings County because I want to remind people that we have something that's free, that's available, it's ubiquitous, it's in abundance, that can save your lives, that can make you breathe a little easier. Take a deep breath this Halloween, or rather this Thanksgiving and Christmas, knowing you're doing something not only for yourself, but your loved ones. Freedom to protect yourself and the freedom others will have, knowing they're more protected because you are impacting their health at the same time. And so we'll just continue to pound and push back against misinformation, disinformation, continue to promote with cultural competency, community-based organizations, 70 CBOs, community-based organizations here in Central Valley, 34 partnerships like this with schools. We'll continue to do the hard work at the grassroots to counter that.
Thank you, everybody.
What else? Good. Sorry, that was long. Those were long-winded answers. So you just relieved. I know you're all relieved, like, oh, not another question. So thank you all very, very much. And thanks again to the mayor, supervisor, and superintendent. Thank you, guys. Appreciate it.